Cognitive behavioural therapy. Cognitive behavioural therapy is one of the leading therapies in the management of anxiety, and it's been shown to be effective in over 50% of people. An ancient Greek philosopher once said, "People aren't disturbed by events, but by the view that they take of these events." The principles of cognitive behavioural therapy. So the therapy looks at both cognitions and behaviours and the effect that they have on the way that we think and feel. The beliefs are that people with anxiety have a negative thought pattern and that this affects both how we feel and the way that we act. For example, on the way to work in the morning, you trip over a stone and you think to yourself, I'm going to have a bad day. When in fact tripping over a stone doesn't mean that you're going to have a bad day. So examples of this may be going to the pub for a drink with friends. On one scenario, you may have the thought of, I'm going to have an attack and I'm going to faint and make a fool out of myself in front of all these people. This will lead to feelings such as being worried, anxious or sad. And then this will also have an effect on the way that we behave. So we may have frequent visits to the toilet to calm ourselves down. We may have frequent visits outside to have cigarettes. Or we may leave the party early so that we can get home and feel safe. On the other hand, if our original thought was, it's going to be so nice to see all of my friends and catch up, this would lead to feelings of happiness and excitement. And then this would affect our behaviour, and we'd probably end up staying out late, chatting all night with friends and having fun. Cognitive behavioural therapy aims to teach people how to identify these negative thought patterns and how to change them into more neutral and positive thoughts. It also aims to teach people to identify negative behaviours and to change these into more negative and positive behaviours. There are many different cognitive behavioural therapy exercises. Here are two examples. The courtroom. This is an exercise that helps you both identify and challenge negative thoughts. The steps are as follows. So step 1, you would pick a specific thought and write it down. Step 2 is to defend that thought with the evidence that you have to support it. Step 3 is to prosecute the thought with the evidence to suggest that the thought isn't true. And then the final step is the judgment, where you weigh both sides of evidence and come up with a more accurate thought. An example of this would be the thought, my boss hates me. The defence for this thought may be that he always seems to give me the worst jobs to do, or he always has a go at me when everyone else at work does exactly the same thing. He always makes me feel stupid, or he always talks to the other staff as if they're friends, but he doesn't talk to me like this. The prosecution may be that I haven't been there as long as other people, and that he doesn't know me as well as other people in work, and maybe that's why he finds it harder to talk to me. He does joke around with all of the other staff too, but maybe they don't take offence because they understand his sense of humour better. Maybe he is joking around with me too. The judgment for this thought would be, maybe he gives me harder work to do because he knows that I do my work well, and maybe he is joking with me and I just need to get used to his sense of humour. So overall, maybe I should just try and let it go over my head and not read too much into it. The second thought that we might have might be, I'm not good enough for my mother. The defence for this thought might be that she always seems to have a really bad attitude towards me, and that she always seems really friendly and talkative to my sisters, but only argumentative towards me, and that my sisters can talk to her and tell her things, but I can't do this, and that she always makes things up to get attention. The prosecution for this thought may say that my sisters don't live with my mother, and so maybe that's why they have a better relationship. My mother does hug me when I'm sad, and mothers have to love their children. She spends money on me and buys me things, and she does tell me that she loves me. The verdict of this may be that I am good enough for my mother. My mother just has her own problems, and because I live with her, I'm the closest person to soak up these problems. Cognitive behavioural therapy does have many advantages. For example, writing thoughts down can stop them spiralling out of control in your head. It helps you to recognise negative thoughts, and it helps to teach people that these thoughts are not always true. It also helps to change thoughts into more neutral and positive ones. Cognitive behavioural therapy also focuses on behaviour, and it looks at whether our behaviour contributes to how much anxiety that we feel when we face certain situations. It looks at behaviour as having 3 stages: the antecedent, the behaviour and the consequence. An example of this would be John. John goes to the supermarket and is overcome with feelings of panic and anxiety. When he leaves the supermarket and goes home, these feelings go away. The more this happens, the more John is reinforced by leaving the supermarket, and the less likely that it will be that John will go to the supermarket in the future. But this will only lower his self-confidence, and this is a cycle that has to be broken. So how do we break the cycle? The only way to break this cycle is to stay in the place where we feel the fear. Your anxiety will rise, but then it will reach a plateau and then it will begin to lower. The more we practice this, the less anxiety we will feel and the quicker that the anxiety will fall. Before we start the process though, it is important to understand the importance of our breathing and to arm ourselves with relaxation techniques that have helped us in the past. We also don't have to face all of our fears at once, and many people find it easier to break the cycle with a gradual exposure. An example of this would be agoraphobia, avoiding going outside of the house. Step 1 might be to open the curtains and just sit by the window and watch things happening outside. Step 2 may be just to go outside for 1 minute. Step 3 might be going outside for 3 minutes. Step 4 for 5 minutes, and step 5 for 10 minutes, until eventually we can take a 1-minute walk and then gradually increase this. These steps can be tailored by yourself, and as your self-esteem and self-confidence grow, the steps will become easier.
I worked with my therapist for a long time on being able to go to the places that cause me to feel panicky. It's a natural thing to stop going to the places that make you feel anxious, but this only makes it worse. We started off with the easier things and then gradually worked up to the harder situations. Before we go somewhere, we talk about what I should expect when we confront it. This really helped because I felt like I knew what to expect. Fear is biggest when it's in your mind, and when you've actually faced what you're fearing and stayed there anyway, you feel so good about yourself. It's like passing an exam or a driving test. Before we went anywhere, we'd talk about relaxation techniques, like the breathing, and this really helped me to feel like I had some control over the situation. We would also go through a couple of positive statements that I could say to myself in the situation, like every day and every way I'm getting better and better. At first, when I went somewhere that I dreaded, I felt so anxious and would panic. But by not leaving the situation, it's like retraining your brain to know that it's not a dangerous situation. The next time we went, I still felt panicky, but the feelings didn't last as long as they did the first time. When we kept repeating it, I was able to compare, say, the first time we'd done it to the 5th. I could see that my anxiety was decreasing a lot, and this helped me carry on with the therapy. Thinking about going to these places and putting yourself through all the panic is far worse than actually doing it. When you've done it and got through it, you know that you're stronger and the fear, and this boosts your confidence and self-esteem. I'm so grateful to my therapist for making me face my fear. She's helped me to get my life back.
Anxiety always involves thinking of a variety of issues, lifestyle issues and psychological approaches to minimising anxiety that occurs in certain situations is very, very important. Medication can be important in certain circumstances, and these are where anxiety is very severe or if it's very long term, or if it's not responding to psychological or lifestyle approaches. What we know is that there are changes in the brain relating to chemicals which occur and produce anxiety symptoms, and we can help with those changes by certain medications. And over the years we've come to know that different types of medication can be effective in anxiety. So one of those types is the benzodiazepines, and diazepam or Valium is an example. We tend to only use those sorts of medication in situations of short-term use and very severe anxiety. And the reason is that although they're very effective, they can be addictive. Other sorts of medication that we commonly use are antidepressants, and things like sertraline or citalopram are examples. And those can be useful over a longer period of time and can help with anxiety that's generalised, or, for example, with panics. Typically those would be used for a period of at least several months. And they have the advantage that they don't tend to be addictive, and they can also help prevent depression occurring. Another sort of medication that we know can be helpful are those used for treating epilepsy, and an example would be pregabalin. So just to reiterate, medication can have an important role, but it's part of an overall package of help, which always will also include lifestyle advice and psychological approaches to trying to minimise anxiety.
So now we're going to look at lifestyle choices. Dr. Roger Walsh quotes, "A wide range of mental health conditions, including depression and anxiety, can be treated with certain lifestyle changes as successfully as diseases such as obesity and diabetes." Lifestyle choices can certainly affect the level of anxiety that we experience, and here we will focus on three main lifestyle choices: diet, sleep, and exercise. Firstly, we will look at diet. Lots of people turn to comfort eating when they are feeling anxious, and this can lead to a short-term decrease in anxiety. However, comfort eating will cause long-term problems. Research shows that certain foods tend to decrease the amount of anxiety that we feel, and research also shows that there are certain foods that tend to increase the amount of anxiety that we feel. For example, vitamins. Vitamins play a really large role in our nervous system. Vitamin B is responsible for making some of the most basic structures in the nervous system. It also helps the nervous system to maintain its proper function. Calcium helps our nerves to be healthy and also ensures that they can communicate. A lack of potassium can contribute to nervous disorders, and a lack of magnesium can contribute to nervousness and confusion. And then there's tryptophan. This is the building block to serotonin, which is known as the happy hormone, and it's found in dairy products. So good foods to eat, things such as fruit and vegetables, garlic and yogurt, peanut butter, whole grain rice, pasta and bread, and things like tuna, chicken, cottage cheese and milk. And then there are foods to avoid or to limit, such as sweets, cakes and pastries, cheeses, fizzy drinks, Coke, coffee and tea, which include caffeine, and things like alcohol. Although alcohol may be relaxing in the short term, it has long-term consequences. Alcohol reduces chemicals that help us to deal with anxiety, and withdrawal symptoms from alcohol also increase anxiety. Now we're going to look at exercise. Exercise is very good for you for a number of reasons. It's a good distraction from thoughts that may be worrying us, and it also helps to improve our mood by releasing natural endorphins. Physical exercise in the day will help us to get to sleep better in the night, and it also decreases the effects that stress can have on our bodies. Exercise is also good when we've been over-breathing, as it can help to balance out the amount of carbon dioxide and oxygen in the blood. And it can also help to combat side effects of certain medications, such as weight gain. It is important to gradually build up the amount of exercise that we do. Research shows that people who gradually increase exercise into their lifestyle are more likely to keep up with the exercise regime than those who dive straight away into really exhausting workouts. So we should start with baby steps and then increase. So why does exercise improve our mood? When we exercise, our body releases natural endorphins. These are natural morphine-like substances that have been linked to not only well-being but happiness. The more endorphins that we have in our body, the more likely it is that we will be able to get rid of negative mental states such as anxiety and depression. Now we're going to look at sleep. Sleep is extremely important because, like the rest of our body, our brains need rest. We should try to aim to get the right amount of sleep, which is between 7 and 9 hours per night. It is also important that we sleep at regular times. This will help our internal body clock and in the long term will help making falling asleep easier. Problems with sleep are common for those who suffer with anxiety. 1 in 3 adults will complain of sleep problems throughout their lifetime. The most common sleep problems are getting to sleep, staying asleep, waking up too early in the morning and then not being able to fall back to sleep, or less commonly, hypersomnia. Some people find that they oversleep, and if they sleep for around 7 to 9 hours per night, they feel very, very tired during the day. Useful tips on sleeping. So doing relaxation exercises before bed will help you to fall asleep. And it also helps if you purely associate your bed with sleeping. So don't do anything else in bed, such as watching TV or reading. Don't go to bed until you feel sleepy, and if after 20 minutes you still don't sleep, then get up. Make sure you get up the same time each morning, even if you've had a really late night because you couldn't sleep, and make sure you don't catch up on sleep during the day. Don't exercise in the evening, as this can also keep you awake at night. And don't drink caffeine after 6 p.m. Warm milky drinks before bed are really good to help you feel sleepy.
Why is self-help so important for those suffering with anxiety? The NICE, that's National Institute for Clinical Excellence guidelines, place great emphasis on self-help in the management and treatment of the anxiety disorders. Systematic reviews and analysis have found that self-help techniques can lead to substantial improvement for a very broad range of health conditions. Such an approach can involve following advice from relevant self-help books or through attendance of a self-help group. Peer group therapy can be a powerful force in helping people to overcome many conditions, and the number and variety of self-help groups available is testament to their beneficial nature. These groups support people in a number of different ways. They offer specific information about the condition, as well as coping strategies or alternative techniques for the treatment or management of it. It's commonly accepted that informing a patient about health issues greatly improves their treatment outcome, and that self-monitoring of symptoms can maximise the benefits of drug treatment. Those attending the group are awarded with an instant identity. They all share the same common experiences. They're not alone or unique in their suffering, and this creates a strong sense of commonality within the group. Attendance at such groups can empower people to realise that they're in a position to help themselves as well as others. It's been shown that people who have the support of such groups are better equipped emotionally than those who face their problems alone. One particularly beneficial aspect of such groups is the helper-therapist phenomenon, a process whereby those who help others within the group find themselves also benefit from doing so, either through reframing or reflecting on their own problems, or through deriving a social usefulness and feel-good factor from helping someone else. Walk Free is a self-help service based in Cardiff which supports and assists people suffering with primarily agoraphobia, anxiety, panic disorder or social anxiety disorder. Walk Free is now a registered charity being formed in 1981 at grassroots level by two sufferers of panic who coincidentally met and recognised a need for such a support mechanism. To date, there are 3 walk-free self-help groups held on a weekly basis situated in Cardiff, which serve the surrounding locality. The groups are facilitated by health, psychological or social services staff who've had training and experience in mental health care. And should you be interested in attending one of the groups, you'll be assured of a warm welcome. Full contact details for Walk Free can be found on the main menu of this DVD or on the reverse of the DVD packaging. Thanks for watching.